Nursing Care of the Haitian Population by Maureen Flynn, Taffy Randolph, Jessica Conklin, and Kelly Baggett. Haiti is one of the poorest countries in the world, having no formal infrastructure for health care or social services. Many Haitians go without basic literacy, health promotion, and/or primary care services to identify, treat, and follow up with chronic health conditions. Researchers sought to understand within the Haitian community the definition of health and wellness in order to provide culturally competent care. Insight into the way Haitians prefer to receive information, education, cultural norms, and the dynamics of family and community will facilitate a trusting environment, promoting health and well-being via culturally competent care. For the Haiti people, their primary language is either French or Haitian Creole. Though Creole is considered a poor man's language, so French may be preferred. Catholicism and Voodoo are the two main religions and are often practiced together. Sickness is thought to be brought on by evil spirits or as punishment brought on by the will of God. Drug use and homosexuality are typically condemned. Haitians typically rely on traditional medicine practices such as herbal medicine, prayer, music, and lifestyle modifications. They may consider biomedical interventions as a last resort. Women in Haiti often give birth at home, attended by a family member or an untrained traditional birth attendant. Teaching the traditional birth attendants the importance of maintaining a sanitary environment to decrease infection and the importance of uterine massage and immediate breastfeeding to stimulate uterine contractions and help prevent hemorrhage is essential in decreasing complications associated with childbirth and maternal mortality. Cultivate a willingness to learn how they do things and how you can teach them to do those things in a safe manner, rather than trying to teach them how to do it your way. Haitian culture centers on the family. Often, many generations and family members live together. In Haiti, women usually make their own health decisions for themselves and for their children. However, when there is a husband, he will usually want to make major health decisions, such as those regarding surgery for his wife. Some challenges for nurses providing care to Haitian families is obtaining an accurate health history and a family health history. Obtaining an accurate personal or family health history may be difficult, if not impossible, because many have parents or other close family members who died in Haiti without medical care or a formal diagnosis. Men often have a polygamous lifestyle and rarely use barrier contraception, so the rate of STDs in pregnancy is high. Many Haitian women are culturally desensitized to domestic violence and abuse, as violence against women is seen as common. The severe poverty in Haiti makes it very difficult for families to survive. The cost to feed, clothe, and educate many children is often too much to bear, and many times parents will go without food for themselves. Haitian families often reach a tipping point that leads to the relinquishment of their children as a result of several factors, including high birth rates, death, disability, or unemployment in the family, displacement or other natural disasters such as the hurricanes of 2009 and the recent earthquake. There are approximately 4.5 million children in Haiti, nearly half of the total population, with most living in poverty. Less than half the Haitian children are able to attend school. Education is valued by Haitians, and families will make every effort to put their children in school, although most education is only for about 5 years, as school is not free and must be paid for and is often unaffordable for families. There's a high prevalence of HIV in Haiti, and many children are affected. Obtaining appropriate health care for HIV is often a challenge. The grave economic conditions in Haiti often leave parents unable to care for their children. Children are often given to more affluent families in the hopes they will be able to provide food, clothing, shelter, health care, and education for them in exchange for work. Child labor in Haiti is widespread, and child laborers are often abused. The practice of leaving orphaned or abandoned children with families who may be less impoverished is common in Haiti and represents a critical human rights issue for children. In the U.S., there is a high percentage of Haitian children that suffer from childhood obesity. Haitian parents believe a contributing factor is the lack of fresh foods available at an affordable price. Another contributing factor is the parents' fear of U.S. authorities. They fear they will be accused of child abuse if their children are too skinny, and they also fear their children will claim child abuse if they force them to do activities that promote exercise and eat foods that they don't want to. For the Haitian adult, determinants in seeking care include how Haitians define wellness and illness, as well as their access to health insurance. If an illness is defined as a natural occurrence, treatment is not sought or prescribed therapy is not maintained. Hypertension, diabetes, heart disease, and HIV are some illnesses affecting the Haitian adult population. It's important to know if they are seeking treatment from a traditional healer, practicing voodoo, or utilizing injectable substances procured from Haiti, as they will have it administered by a picturist who is someone who performs injections. Haitians are very private about their health. Illness may be perceived as weakness. There are different types of knowledge: emic knowledge and etic knowledge. Emic being the general or generic knowledge the local culture has versus the etic knowledge or professional knowledge of outsiders. To provide culturally competent care for the Haitian adult, it's important to get an interpreter in either French or Creole, obtain a health history and assessment without other family members present, assess their knowledge, beliefs, and perception about what is happening within their bodies, and their preferred method of treatment. Pender's health promotion model stresses promoting health within the individual and community cultural heritage. Know what traditional resources they have available to them and seek to address their health and treatments within the context of those resources and their beliefs to facilitate compliance and optimal outcomes. For the older Haitian adults, the care of the elders may be complicated by multiple health issues in combination with literacy and language barriers. They are typically cared for by family, but may be homeless if they have no children. Traditional gender roles that limit access to education for women in countries like Haiti make them more disadvantaged in later life than men. Lack of access to care may lead to debilitating complications of easily controlled diseases such as vision problems, high blood pressure, and diabetes. Death results in a return to the Creator in an afterlife. Haitians prefer to die at home with family at the bedside to provide spiritual support. After death, the body is given a last bath by a family member and is kept until the whole family gathers. Since keeping the body whole is needed for resurrection, cremation is not a common practice. Organ donation is also not common. Some families may request an autopsy to ensure the person is actually dead in order to avoid zombification. For the Haitian community as a whole, barriers to health for Haitian immigrants include fear of deportation, language barriers, believing in the value of traditional healers and cultural medicine over Western medicine, their perceived lack of privacy in facilities and clinics run by people within the Haitian community, low literacy rates, financial strain, stigma of having a mental illness, and stress regarding problems in Haiti. Some Haitians prefer not to go to organizations staffed by Haitians, even if this meant elimination of language barriers. These individuals cited concerns about confidentiality and privacy. They don't want to be recognized by other people whom they may know. The Haitian community, for example, of Boston, relies on and receives a large portion of their information from local Haitian radio and television. Radio and television are a way to get health information to the Haitian community in Boston. And due to the preference by the community to seek health care from traditional healers, institutions may want to explore whether to provide traditional healers with training in Western medicine. In summary, Haitians are a poor people with a rich history and culture rooted in staunch nationalism. They face what can seem to be insurmountable obstacles in economic and health disparities. In order to support this community, healthcare providers will most definitely face challenges with all age groups. Combating poverty, educational and language barriers, deep-seated, ritualistic and traditional beliefs that not only differ from, but also distrust Western medicine and practice will impact the way culturally competent care is delivered. Instead of simply educating the Haitian population, healthcare providers will need to educate themselves with Haitian beliefs as well as with traditional practices, resources, and collaborate with healers within the context of Haitian culture to achieve the care they seek to deliver.